Hi, I'm Melissa Bantug in the Johns Hopkins Breast Cancer Survivorship Program. Today we're joined with Dr. Jennifer Barsky Reese. She's an expert here talking about sexuality and intimacy concerns after cancer. Hi, Dr. Reese. It's great to have you here.
Thank you so much for having me, Alyssa. It's great to be here.
Good. To start off, can you tell me some concerns you hear from patients at the end of treatment that they may have regarding sexuality or intimacy?
I'm really glad you asked. I think it's a really important topic that we need to discuss and that it isn't often usually discussed, so I'm really happy to be here. About half of breast cancer survivors tend to report some kinds of sexual concerns, and those can range across different aspects of their either physical functioning or emotional or psychological or even interpersonal aspects of their sexuality. Some common sexual concerns, and they do tend to range, but they're often dependent on the kind of treatment that a patient has had. So for example, breast cancer survivors who've had surgery, who've had mastectomy, with or without reconstruction, oftentimes will say that they have some body image disturbance. They may have issues with the scarring that they've had, and they may not feel as attractive, and that can get in the way of their ability to enjoy sexuality or desire to be sexual with their partner. Women who've gone through chemotherapy often cite hormone-related problems or side effects of chemo, for example, and oftentimes those can be related to early menopause that chemotherapy can cause for women. So some common side effects might be hot flashes and different side effects like that, in addition to directly impacting women's sexual function by causing vaginal dryness and some pain or discomfort with sexual activity. And then finally, for women who are on tamoxifen or other aromatase inhibitors, they can also have hormone-related changes and side effects of those treatments that can impact their sexuality. Hot flashes, again, can be very bothersome, vaginal dryness, and pain or discomfort with sex. And of course, loss of sexual interest is another very common concern that breast cancer survivors often experience, and that can be due to a number of causes.
It sounds like some of these issues may be physical or psychosocial or a combination of those. Can you tell me that if a patient is experiencing some of these concerns, how they find the right provider to talk to?
That's a great point. I think, first of all, it's important to acknowledge that there oftentimes are kind of a multitude of issues that are happening and going on at the same time. So for example, a woman who's having some vaginal dryness and discomfort with sex is probably not going to be that interested in engaging in sex because it's not that pleasurable for them. Same thing with women who are not feeling all that aroused, aside from the vaginal dryness, but maybe they're not able to relax during sex. They may not be able to climax as easily as they did before, so they may not be as interested in sex too. So I think it's first of all just important to acknowledge that it can be very difficult to tease that apart, to tease all the different influences on sexuality apart. The first recommendation that I would have in most cases is to talk with a provider that you feel comfortable going to about the sexual concerns or sexual changes you've been experiencing, because that provider may be able to help you tease out what's going on. So for example, for a breast cancer survivor who's having discomfort or pain with sex, that's a common and a very distressing problem, but it's a very important one to bring to the attention of your provider. Especially if your oncologist in particular, if you're on a long-term kind of hormone regimen like tamoxifen or an aromatase inhibitor, because they may, first of all, be able to make some changes in the medication, or they may be able to prescribe you different kinds of medications to other medications to help relieve some of the symptoms you're having. But with pain, you do want to be sure that there aren't other causes and other medical contributors to that pain. And so your provider may refer you to a gynecologist that can conduct a further, more thorough evaluation to be sure and to really rule out kind of other important medical contributors to that pain.
If a patient identifies that the concerns that they may be having aren't medical, As a clinical psychologist, can you give me some tips that you may offer patients with regards to improving their intimacy and sexuality?
Absolutely. I'm so glad you asked. This is what I love to talk about. I think there are so many things that you can do. First, emphasizing, of course, that I do think that there can be an important medical and physical contribution. One thing we haven't discussed yet is depression and anxiety. And so if those feelings are coming up and are interfering with your ability to be sexual, please do bring those to a provider, because there are either medical or other kinds of therapy, cognitive behavior therapy, for example, that can be very, very helpful. And if that's impacting your ability to enjoy sex, then really that should be addressed. But in terms of other kinds of suggestions, once we've kind of identified and maybe helped figure out what we can do about some of the medical contributors, then what I would say, and where I guess I kind of always start, is with communication. So communicating with your partner is absolutely critical in terms of enjoying not only your relationship, but certainly your sexual life. And because you may have gone through changes, it's especially important to be really direct and be very upfront with your partner about what are your sexual wants and needs. Because if you don't share those, then your partner is going to have a very difficult time of helping you meet those needs. So along those lines, it's important to have a supportive partner who's willing to listen and hopefully willing to help you meet those needs. And if not, if you're having relationship distress on that level, then that's something, again, that I would look more into, and I would encourage survivors to help address that issue. If you don't feel that your partner is being that supportive, or you're feeling that you're having communication difficulties, try to talk to a therapist about that and see if you can help address those issues. So starting with communication, I think very, very important. Being open, being upfront is very critical. I would say that after communication, I would also think that one thing that can happen for breast cancer survivors, really for anyone who's gone through treatment for cancer, is that they've just gone through this kind of whirlwind of treatment. They've gone through this really busy phase. They've been taken out of oftentimes they've been taken out of the enjoyable things that they've been doing. And this is kind of, it's like the couple's relationship can often fall on the back burner. And then what ends up happening is that the couple stops going out for date nights, stops doing the things that are really fun and enjoyable, and that can kind of, make them more likely to be sexual with one another just because they're enjoying their time together. And so what I would really kind of emphasize for couples is make sure that you're scheduling some time together as a couple. Make sure that you're spending some time together to connect with each other, to look into each other's eyes. It sounds kind of corny, but to feel, connected with your partner, and to make sure that that's a priority. And so kind of helping to revisit some of that issue as well, making sure you have date night or whatever it is that's meaningful to you that you've previously enjoyed in your relationship. So that's another aspect that I would emphasize.
It sounds like from what you're saying that going back to the basics may be helpful here. So things that you used to do when you first started dating, scheduling time to spend time with one another or going out on date night, sounds like that could be really critical in trying to find ways to regain sexuality and intimacy with your partner.
Some things that I would really think about doing, first of all, kind of when you're sort of getting back into the swing of things, so to speak, of being sexual with your partner again, now that busy phase is over and you want to reconnect and become intimate again physically with your partner, what I would suggest doing, and kind of the larger message might be to take things a little bit slowly and be patient with each other. What I might suggest doing is maybe kind of starting out with some kind of low pressure types of activity, physical contact, just deep kissing for a while, with no expectation of going any further with your partner, can be really stimulating and exciting. And, again, going back to basics, kind of when you were dating, what were the things you did physically before you got to that stage where you kind of had to have intercourse, for example. So deep kissing with your partner, or just caressing each other in ways that are kind of, that don't necessarily have to lead from one thing to the next, although they could, but they don't have to. But emphasizing and making sure that those activities are really a part of your physical relationship, I think are really helpful, not only to sort of take the pressure off, but also to get you back in touch with each other again, and to help it become more comfortable again, to restart, and rekindle your relationship. So those are some things. You may even want to think about some sensate focus exercises from Masters and Johnson, kind of classic sex therapy techniques where you're really just relearning to enjoy physical touch with each other.
If a patient who may be experiencing some vaginal dryness due to endocrine therapy or other treatments, are there things that you recommend that may be helpful?
Absolutely. Yeah, I think it's a great question, and I think it's a really important question because endocrine therapy can be for such a long period of time. And so it's really important to kind of address the issues and make sure that you can enjoy your sexual relationship for the next, up to 5 years. So one thing that I would say for vaginal dryness, so I think there's a couple of things that are really important. First of all, what I would suggest is making sure that the vaginal moisture is kind of increased. So you may want to use something like Replens, which would be kind of a daily or regular routine, and you can definitely talk to your provider about that, and there's a lot of information on the internet about that too, or reading about that, but that can be very helpful for helping to restore some of the health and integrity to the vaginal tissues, which can become very thin and delicate as a result of these treatments. But the other thing, in terms of actual sexual activity, is to be sure that you're using a water-based lubricant. So there are many, many kinds out there available at your drugstore or available on the web, but really being sure that you use those. And I would suggest even trying to use them on every occasion that you want to engage in some kind of penetrative sexual activity, as it will really make things a lot more comfortable in terms of sexual activity.
If a patient wants to learn more about resources available with regards to intimacy and sexuality, where are some places that you would recommend?
Some of the really good resources that are available, there are a number of books that are available, there are a lot of websites that are available. It's almost overwhelming. I think that the issue of sexuality in breast cancer has become such a hot topic that it's almost hard to sort through. There's so much out there. So I think some good places to start might be, in terms of websites, would be the American Cancer Society has a really, really good booklet, which is very long, called Sexuality for the Woman with Cancer. And there are some aspects in there that are specific to breast cancer, but there's also some issues that are going to be overlapping with other types of cancers that affect women. And there's just a lot of information and some good suggestions and pretty detailed information in there that can be helpful. And the National Cancer Institute, or NCI, website also has information that's been very thoroughly researched and that can give you some information about effects of breast cancer and other types of cancer treatments and surgeries on sexuality for women. And then a brief search of Amazon will reveal many, many books on sexuality for women with breast cancer, and also in terms of the partnered relationship, issues that your partner or spouse may want to think about reading as well, to help you be able to cope and to continue to enjoy your relationship and your intimacy together.
Great. This has been really helpful. Thank you so much for giving us some useful tips about what patients can think about after breast cancer treatment with regards to sexuality. Thank you for joining us. I hope this was helpful.